Hi everyone. Today on a day, World Heart Day, I myself, Dr. Manish Parmar, MD physician, who is currently practicing in Vadnagar, are going to talk little bit on hypertension. What is hypertension? What are the causes? And what are the different treatment modalities? We will specially speak on a lifestyle modification. So hypertension is basically defined as a systolic blood pressure of 140 millimeter of mercury or and diastolic blood pressure of more than 90 millimeter of mercury. So hypertension is a major public health issue in India. Roughly around 25% of urban population and 10% of rural population are suffering from hypertension. There are two types of hypertension. One is essential hypertension, which roughly consists of around 95% of population, and second type is secondary hypertension. So secondary hypertension could be because of renal cause or endocrine cause. Now we come to the classification of hypertension. There are mainly like normal, which consist of systolic blood pressure less than 120 millimeter of mercury and diastolic blood pressure of less than 80 millimeter of mercury. Then comes the pre-hypertension, where systolic blood pressure measurement would be around 120 to 139 and diastolic blood pressure would be from 92 to 99, 80 to 89. Then comes hypertension stage 1, that is systolic blood pressure of 140 to 159 and diastolic blood pressure of 90 to 99. And type 2 hypertension is where the systolic blood pressure is more than 160 and diastolic blood pressure is more than 100. What are the risk factors of hypertension? Which people who are more vulnerable to the hypertension? These includes people with advancing age, most commonly the elderly one of age group of more than 60 years, especially the men and postmenopausal women, which are who are most vulnerable group. Uh, Other people who is having sedentary lifestyle and psychosocial stress, who are having family history of cardiovascular disease, uh, the people who smoke more, having more alcohol and high cholesterol diet, they are more vulnerable to develop hypertension. What this hypertension does to our organ, they have some target organ damage. Likewise, LV hypertrophy, angina, myocardial infarction, heart failure, stroke, transient ischemic attack, CKD, and peripheral arterial disease. Now comes the treatment part of the hypertension. Hypertension mostly consists of lifestyle modification and pharmacological medication. Today, on this day of World Heart Day, we will talk more on a lifestyle modification which helps in preventing the development of hypertension or the progress of hypertension, and also helps in a already hypertensive patient to prevent the end organ damage. So what are these lifestyle modification? This lifestyle modification consists of loss of weight, increasing physical activity, reduce salt intake, stop smoking and alcohol, increase consumption of fruits and vegetables.